Hi everyone, my name is Christine Bozik, and I chose to base my overview on Canada's healthcare system. The article I chose is called Sustainability is Not the Issue, Let's Focus on Quality. I chose to talk about the overview of this article specifically because it seems as if the quality is one of the main focuses when dealing with the Canadian healthcare system. So I wanted to give a fact, which is Canada is the second largest country in the world with an estimated 37 million people populating this area. So keep that in mind how many people are actually using this healthcare system or will eventually be. So in Canada, they use a single payer healthcare system, which is a type of universal healthcare financed by taxes that covers the cost of essential healthcare for all patients, which means all of the costs are covered by a single public system. I also wanted to go over in the presentation what makes the Canadian healthcare system stand out, who's involved, and the overall quality of this system. So as far as Canada's healthcare system, with few exceptions, Canadians never worry about incurring healthcare expenses. Canada's national health insurance system, which is also known as Medicare, ensures all Canadians have access to quality health care. This is a publicly funded and privately distributed healthcare system from the state or regional governments, and as we know is free of charge, although there's assistance given from the federal government for funding as well. In addition, wait time is extended due to the scarcity of hospital rooms, medical supplies, the staff, and more. So I wanted to give a list of some of the providers in the healthcare field, which are the hospitals, nurses, physicians, surgeons, dentists, the pharmacy, chiropractors, and anesthesiologists. So I also wanted to go over the services that are offered, which includes child development, maternity care, rehabilitation services, prevention and treatment of diseases, injury care and treatment, as well as mental health care. So some of the underlying issues is, will there be quality care received? And if so, who is there to determine it? Is this based around patient-centered care? Once again, are the doctors just trying to get the patients in or out, or are they actually doing the correct procedures, making sure that it's done correctly? As I mentioned before, there's long waiting times, mainly because it is free, but this could also lead to excessive visits, and when does this stop, and what is included to be acceptable or not. So I read in an article that in 2014, for the first time in history, there were more seniors than children in Canada. So the fact that there are more Canadians that are living longer and healthier than ever before, it's definitely an achievement, but this prevents some economic challenges because on average it costs more to provide health care for older people than it would for children. So in the article, it discusses 6 high-quality care that's included in the healthcare system, which is patient-centered care, effectiveness, timeliness, efficiency, fairness, as well as safety. So as far as focusing on the quality, in the article, it discusses ways to improve upon the goals and habits to acquire in the healthcare system. So we need to shake off the habits and attitudes of the 20th century healthcare system that have led to a narrowly focused and often wasteful system that doesn't do enough to prevent the illness or promote overall health, which can often fail to satisfy to the patients and as well as wear out the people who care for them. What would focusing on the quality mean in action? First, it will be dependent on the information. We cannot have quality care without the fast and thorough implementation of electronic healthcare records for primary care providers so that all Canadians can have the fullest possible advantage of information technology. Complete and effective electronic healthcare records are essential for measuring, monitoring, and public reporting for indicators of care as well. So I also wanted to go over how to improve the care. So as stated in the article, here are ways that were discussed to improve their healthcare system. One would be attaching enforceable conditions to any agreement. So the Liberal Party campaign is more focused on family, where the Conservative Party has had a little to say on health. But neither party has proposed a comprehensive plan altogether. But if there was a shared goal in mind, that would probably be the best case scenario. So the main question is this system working? So Canada spends less per capita compared to the United States and performs better on a wide range of indicators like life expectancy, obesity rates, infant mortality, as well as deaths. So theoretically, this could have been avoided by timely and effective medical care, according to the article. So Canada's status is the only country that is developed in the universal health care that does not cover prescription drugs. So almost 1/4 of Canadian household members, there is someone who's not taking medications because of their inability to pay. So in Canada, it's known to have access problems. So there's nearly 1 in 5 Canadian patients with 4 months or more for elective surgery. So in addition, Canada's healthcare does not cover dentistry, psychologists, medication, home care, long-term care, and more. This means that most Canadians rely on private insurance from their employers or the government to pay for those costs. Therefore, it is said that the healthcare system can be viewed as more so of a payment system. The Medicare system covers the costs of doctor's visits and hospital care, yet leaves out other important medical needs as well. So this is my works cited page. I just wanted to thank you all who viewed and went over my presentation. So thank you again.